Knee pain can disrupt your daily life, especially when it's caused by something unexpected, like a Baker's cyst. This swelling at the back of the knee often leaves people confused, frustrated, and looking for answers. But what if you could ease the pain and improve your mobility right at home? Today, we reveal the best physiotherapy exercises designed specifically for Baker's cyst relief. These simple, science-backed movements can reduce stiffness, improve circulation, and help you get back on your feet without relying on medications or surgery. A Baker's cyst often forms due to excess fluid buildup in the knee joint, commonly linked to arthritis or injuries. The key to relief lies in gentle, controlled exercises. Start with calf stretches to improve blood flow and reduce tightness behind the knee. Next, perform hamstring stretches while lying down, which relieves pressure and increases flexibility. Strengthening the quadriceps through straight leg raises helps stabilize the knee joint, preventing further fluid buildup. Finally, add gentle heel slides, a movement that maintains mobility without straining the cyst. Performed consistently, these physiotherapy exercises not only ease discomfort but also improve long-term knee health. Consistency is the secret. Practice these movements daily. Listen to your body, and you'll notice steady improvements. Stay committed, stay strong, and let your knees carry you pain-free into your everyday life.